both arms is a red flag. Do not touch them. Refer them, please. Why?
So you don't just say
No.
Okay, what is spondylosis? No. Right. No. Spondylosis just means spondylolisthesis. Right. Spondylosis is just a posh way of saying joint degeneration in the cervical spine. So cervical spondylosis is just joint degeneration. Doesn't tell us anything. That's like saying skin dermatitis. Okay? The ones we need to worry about. I'll write it down.
Because otherwise, yeah.
Face this way, please.
Then you're talking. Right, look at this.
This is spondylolisthesis. This is generally anterior slippage of a vertebra. In the neck, what level does this happen at? Mainly.
C4, 3, 4.
6, 7 mostly.
5, 6, 7. Yeah.
Mainly, it's C7 from T1, but it can happen C6, C7 of T1. Okay? Anything else, they've probably had trauma. So like a very severe fall, whiplash, very severe, and then it might happen on the OA and the AA, so C0, C1 and C2, but they're definitely not going to be in your room. They'd probably be immobilized in a hospital with a thing. They're not going anywhere.
But this
Okay?
spondylolisthesis is difficult. You've got gradings. Okay, so what's the gradings you have for this?
There's stage 1, 2, 3, and 4.
1 to 4. Okay, stage 1 to 4.
Which ones are you worried about? Which ones will you notice anything?
In 4 and 3, you will not touch.
No. 3 and 4, you may notice it. If they have a 3 or a 4, forget 4 for a second. 3, 2 and 3, they probably had an MRI.
Yeah.
Probably. Very rare that you see someone come in and say, I don't know why my head is like this. Okay? They probably had an MRI. 4, they're not in your room.
Yeah.
2 and 3, they may say, yes, I have this. Do not start moving them around too much. You would probably work, if somebody has this in the neck, you can work the thoracic spine, leave the neck alone. Just do some gentle, very gentle, soft tissue massage work.
What's behind it? Why? What's behind it? Why you say don't touch it?
Because what is supporting here is what we call the anterior longitudinal ligament.
Okay.
For that vertebra to move forward, that ligament has ruptured, or at least stretched.
Okay.
And if you take it in the, not even in the wrong direction, you take it in the right direction and it snaps completely, it's moving forward.
Okay.
And in the neck, it becomes a life-threatening problem.
They start to fuse these things.
Okay?
Because you remember this plastic, elastic and plastic, so the ligament will sway. Once it goes too far, it stretches and deforms.
And it's deformed?
Yeah, it'll deform.
And you could touch it?
Yep.
Well, you can damage it.
It's rare.
In clinical practice, if someone comes in with a grade 1, you'll probably never know. Grade 2, you'll probably never know, unless they do.
3 and 4, you start to...
Not necessarily. It's because there's a step. If there's a visual step or a palpable step, then you're starting to think, oh fuck, there might be something going on here. But unless you've got magic MRI eyes, hold on a minute. Oh yeah, definitely C-sit. Again,
Google a few years.
It depends
Oh, yeah.
how much muscle that person has around his neck, because you might not even be able to feel the transverse process on this guy, because he's got muscle around his neck. Yeah. Again, it's going to go with your case history. We're looking at things like if there's a slippage or there's some form of caudal compression, we're thinking bilateral symptoms. We're thinking, this is why Jimmy said, anything down both arms or both legs is a red flag. You're thinking, hold on a minute, there could be something seriously compressing that cord, causing the bilateral symptoms.
So if we talk about the neck, and it's the same for L5 as well?
Yes. Same thing.
Same thing.
Same process.
Bilateral symptoms, you're thinking maybe quadra equina.
No,
Central
it's the same 1, 2,
compression.
3, 4.
Yes, exactly the same. It's no different.
You treat the
The
same.
two most you can technically have spondylolisthesis at every level of the vertebra, but the most likely are L5S1 and C7T1. That's it.
I have them both, so I know what I'm speaking.
Oh, you have them
There
both.
you go, perfect.
There you go.
There
don't,
you go.
don't touch his neck. What grade?
No, I have in my L5S1 2.
How? Genetically or
No,
trauma?
no, it's because I was moving all the time and then start to be big manager sit all my life, and this
Right.
is what's happening.
Right, okay. So there's a genetic predisposition then.
Yeah.
Okay, that's fine. If it was trauma,
No, it's not trauma.
then completely different because the tissues will feel different. So that's the one you need to worry about. But anyone comes in and says, I have pins and needles, numbness, tingling, a lack of strength in both arms, stop immediately.
If the muscles are good,
We'll get to that another time.
Okay.
That is the next few days.